Hello. Welcome to a brand new community health nursing lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please make sure you have your notes in your notebook ready so you can follow along with this lesson. Thank you for listening to this lesson. This lesson covers family health risks and risks across the lifespan. By the end of this lesson, you should be able to analyze various approaches to defining and conceptualizing family health. You should be able to understand what family health risks are and have an overview of major family health risks. You should be able to understand interrelationships among individuals in family. You should be able to explain the relevant knowledge of family structures and roles. You should be able to discuss the implications of policy and how it affects families, health problems for children and adolescents, and you should be able to discuss adults, older adults, and their risk factors, and you should be able to understand how to design a way to reduce risks. Families and family health risk has been a field that's been studied for many, many years. And I'll tell you, in 1976, Pratt managed to describe what they called an energized family, an energized family being an ideal type of family that was most effective at meeting their own health needs. An energized family had certain characteristics. They have active contact, example, an active contact in a variety of groups and organizations, either the Boy Scouts, a church, a sports, and a theater. They may have flexible role relationships, not only if only the daughter is taught how to cook, only the son is expected to get a job. They have flexibility. They're teaching the girls how to do girl things. They're teaching the boys how to do boy things. They're crisscrossing. They're flexible. They're doing what needs to be done. Equal power structure, not if the husband makes all the decisions, but the wife also helps, and a high degree of autonomy for each family member. The kids know how to be flexible because the parents travel for business frequently. They were called an energized family. That was an example of what an energized family is. I want to just hit some things on family health risks, and I want to make sure that you understand some highlights. Good nutrition is essential for healthy growth and development and influences disease and prevention in later life. So we want to make sure that our families understand good nutrition. The adolescent population is at greatest risk for poor nutrition and health. So we want to make sure that when we're in the home, we're also looking at the adolescents and seeing if they're eating. Immunizations are successful in preventing certain diseases. So when we're working with families, we check about their immunization status and their understanding or any fears they may have about immunizations. Barriers to immunization children are cost and inconvenience. So we want to look at what is it a cost issue or is it because it's inconvenient for the family? The family is a critical part of preventing diseases and also to the development of a child. Social support is one of the most powerful influences on successful parenting. Okay, while we're talking about this, I want to talk about what a family crisis means. A family crisis can happen when a family is not able to cope with an event that becomes a disorganized and dysfunctional. I call a family crisis like something that derails them from where they're at. When the demands of a situation exceed the resources a family can have, we consider that a family crisis. What contributes to a family crisis? I want to talk about transitions. Transitions, movement from one stage or condition to another within a family. These are times of potential risk for families. So as community health workers, we want to make sure that all our families that are vulnerable in the community have the ability to transition from one stage to another. So age-related or life event risk often occur during transitions from one development stage to another. Transitions present a new situation and demands for family. So moving from family home to a smaller condo may be a major change of lifestyle. So we want to look at those. A nurse may also evaluate the events that are taking place, the transitions. If the event is normative or anticipated, it is possible for families to prepare and know what the consequences are going to be. So the nurse is going to help them with normative events. The ones we worry about are the non-normative events, things that they were not aware were going to happen. A death, an illness, a disability, life events can increase the risk for a further decline in family health status. Normative events are those that are generally expected in as part of being growing up. I want to cover a few concepts in family health risks that I want to make sure that you also are aware. Factors that determine and influence whether disease or other unhealthy results occur are called health risks. As a family nurse working in families, we want to make sure that we look at those. There's different kinds of family health risks, and we want to talk about inherited biological risks. We want to talk about social. We want to talk about physical. We want to talk about environmental. We want to talk about behavioral risks. Okay, there's personal health habits continue to contribute to major causes of morbidity and mortality. We want to look at personal health habits of people. The patterns of personal health habits and behavioral risk define an individual in the family lifestyle risk. There's multiple health benefits from regular exercise, for example, that have been identified. So we look at the family personal habits. We know that family health risk can be reduced by paying close attention to diet, to exercise, and to stress management. Okay, we want to look at that. Physical activity can help prevent things like obesity, diabetes, heart disease, cancer, osteoporosis, and depression. So we look at that family from that standpoint. We also look at the family's alcohol consumption. We look at the family's eating habits as far as calcium-rich foods and different things. There's a number of factors that contribute to depression. So we do assess the patient for depression as we look at their family for depression. Heart disease is the most significant problem in the United States. It's responsible for premature death and mortality. So we look at cardiovascular disease because it's a leading cause of death. The nurse in the community is aware of that. Good nutrition and exercise programs are recommended to promote that. We want to make sure that we are focused on that. Cancer is the second leading cause of death, so nurses' second focus would be on cancer risk. We look at the economic risks. We look at the financial resources and to see if they can adequately promote their own health status. We look at their ability to afford adequate housing, clothing, food, education, health, and illness. There's a lot that goes on when a nurse is assessing a health risk. You may hear of the term health risk appraisal. A health risk appraisal looks at the process of assessing for the presence of specific factors in each of the categories that have been identified. Okay, so you're going to look at the likelihood of illness and unhealthy habits. Okay, while we're talking about a health risk appraisal, I want to talk to you briefly about what a genogram is. A genogram would be one of the most effective ways that you can assess patterns of health and illness in families. A genogram, briefly, is a drawing that shows a family unit or a family unit. Immediate interest includes, it tells you a little bit about the family. So this is some examples of genogram symbols. You may indicate this symbol as somebody who's a carrier for disease or somebody who's affected by disease. You may have somebody that has been affected by hearsay but has not confirmed. This is a possible affected person with a question mark. You can have symbols with different colors indicating different diseases that exist in the family as you're trying to track them. Here is an example of a genogram. This genogram tells me a lot. It tells me that Jose and Benita are a couple, and they have Felpa, and there is Jesus over here in Estrella. Okay, and you can look at the symbols and it will tell you their ethnic heritage. This is a symbol. Usually the symbol will actually kind of tell you a little bit. We know that Jesus and Estrella are Puerto Rican, and there's other different things that are indicated on a genogram. I also have a genogram resource that you can look at. So that's one way to look at it. We know marriage is, you can have marriage indicated by a solid line, meaning that they are married and they're not estranged. That's one way of appraising a family health risk, and also looking at their genomic health. What is genomic health? Genomic healthcare can give healthcare providers the tool that they need to use a person's unique genomic information to help them understand the risks that they're risk for and to understand their own genetic makeup. So the nurse may collect this during a family history, not maybe at the RN level. It's just good to be familiar with collecting information and understanding how that's done. Another way to assess health risk is looking at an ecomap, and an ecomap can provide information about relationships that the family has with other people. It could be relatives, it could be neighbors, it could be community resources, the church, the school, the organizations. You're going to see that an ecomap tells us what the energy flow from one group of people is to another group of people, whether it's positive or whether it's negative. So on a standard ecomap, you may see these little signs. You have a system drawn. If there's a positive system, like they say, we really love our church. We love it, we love it, we love it. So you're going to draw that with a positive line, which is a solid line. But they tell you, you know what? We love our church, but it's really, we love our church, but we really, really hate that our son goes to jail all the time. And the jail is a really terrible place. So you're going to draw that with a stressful line and say jail. Son visits jail quite a bit. So it kind of shows, the arrows help you to see the energy flow. I have also included resources on looking at ecomaps as well. Okay, so that's how one way you can actually map out a family's risk factors. Okay, what's important is that we understand how we reduce the risk. So risk reduction is complex. It's complex for the nurse. As you can see, there's a lot going on in a family that what meets the eye. And planning the risks involves understanding where the family is at and what's truly perceived as a risk. Let me give you an example. Let's say you walk in a family and they're all busy, the 3-year-old, the 2-year-old, and the 1-year-old, and everybody's just busy cleaning their handguns. And you think that people should not have guns out. So if a family does not perceive that behavior of having guns in the house as risky, you will not be able to tell them that that's a risky attitude. If they think it's handguns are good for food or a sport, the nurse must first educate and figure out, why do you need these guns out? Are you using a rifle? Are you using a handgun? Are you using, what kind of gun do you have? What are ways you can protect your children? What are risk factors? So just because something looks risky to us, it doesn't mean we're going to go in and tell them what it is that we want them to do. They have to perceive the risk. So it's going to be important. Sometimes risk reduction involves a lot of telling the people that this is a risk. Okay, we know that accidents and injuries are a major cause of health problems in children and adolescents. Most are preventable. What are ways nurses can reduce the risk of accidents and in adolescents and children? Anticipatory guidance and prevention. There's going to be things that you need to actually guide people to make the decision to stay safe. Okay, nurses are involved in strategies that meet the needs of a pediatric population in the family or in the community. So home-based nurse services programs are successful in providing care for at-risk populations. So think about children in homeless families are at risk for a lot of environmental problems. There's community programs. You have to make sure that you're matching the patients with what they need. In this slide, in your notes, I have covered a lot of different risk factors for different population age groups, and I would like for you to look at these. You need to understand the risks in the family for women. You need to understand the risk in the family for women of color. You need to understand the risk in the family for men, and you also need to understand the risk in the family for elderly patients and what nurses can do for each category. So please make sure you read that. Making a home visit is just not a matter of showing up at a family's home. The initial home visit must include a nurse's self-identification and clarification of the role. It's important that when you get in that home, you say, hi, my name is, and I am going to be here because, and you make sure that your role is understood. Families are very complex. You don't want to say I'm here and you end up doing dishes. You end up doing things that are not really in a nurse's agenda for the day. You want to establish rapport with the family. You want to assess the situation for your goal and make sure that your goal can be met. Then you want to determine if the client's expectations of what it is that they're expecting from you as a nurse. In some senses, the nurse is a guest in that home. The nurse is not there for social purposes, but to help the family with health concerns. It's important for you to establish the rapport, but at the same time to make sure that you're not just there as a guest. Okay? However, this is a little tricky. Without the rapport between the nurse and the client, the nurse will notably be less effective. So you've got to make sure that you have a balance there. Okay, there's different phases of a home visit that you have to understand. You have the initiation phase and you also have the termination phase. At the end of your home visits, when you are done for that day, you need to review the visit with the family. You need to summarize what has happened during the visit, and you want to also tell them what you have accomplished that day, and you also want to make sure you make a plan for future visits. This is a very structured to do here. So post-visit, you're going to document the visit and the services provided. This is also a very important part of home visits. It's important that the nurse understands the community resources. There's a lot of special at-risk populations in the community and within the family that require nursing interventions at primary, secondary, and tertiary levels. We should understand what that means by now. And it's going to be important for you to understand health risks across the lifespan. I've included some notes on that in your notes, and you're going to have to make sure that you understand why you're making that home visit. It allows you the opportunity to intervene for those health risks. A nurse working with families needs to understand the impact of health policy and legislation. You may have a durable power of attorney for medical care decisions. You need to understand what that is, and you need to understand how it's going to affect the care. You may have a patient that's on FMLA. You need to have an idea what that means and how it's going to impact care. Thank you for listening in to this lesson. I hope you have enjoyed this overview of family health risks and risks across the lifespan. If you have any questions or about this lesson or any of the corresponding notes, please feel free to email me. You have a lovely day.